Welcome to this medical review video for medical doctors and students. This is not medical advice if you are a patient, talk to your doctor. Hyperhidrosis is the excessive sweating disease. So, what's the difference between GIS and GIS? Well, GIS is just normal sweating. This couple is exercising, and when you do some kind of physical activity, you get a lot of muscle activation, which produces heat as a byproduct. So, your body needs a way to dissipate all this heat, and sweating is one of the ways it does it. Anyone will sweat copious amounts if you go for a run at midday. I practice CrossFit and I sweat a lot there, and I don't have hyperhidrosis. What's not normal is to sweat when it's cold or when you're feeling cold. So, hyperhidrosis is sweating that exceeds the thermoregulatory needs. Besides, when it's hot, you tend to sweat throughout your whole body. It's not normal to sweat only on your palms. It's not normal to be unable to write because you keep getting the paper wet. It's not normal to end a regular day with drenched socks. It's not normal to have sweating localized to the palms, soles, and axilla. However, this is exactly what happens in hyperhidrosis because these are the regions with the greatest density of eccrine sweat glands. Now, of course, there are exceptions. You can have craniofacial hyperhidrosis or inguinal hyperhidrosis, but as a general rule, they are localized to palms, soles, and axilla. Sweating for thermoregulatory needs shouldn't increase when you are under psychological stress. You don't have to dissipate more heat just because you are nervous. However, it does in hyperhidrosis. It's not normal for sweating to cease or dramatically improve at least when you go to sleep. If it's hot, you should keep sweating either awake or asleep. It's not normal for sweating to drastically worsen along puberty. However, primary hyperhidrosis usually starts in childhood or adolescence. And it also has a familial component, meaning there is usually some family history of the symptoms. You may have noticed I've started using the term primary hyperhidrosis. That's because once you diagnose hyperhidrosis, it's important to exclude secondary causes. Hyperhidrosis can be either primary or secondary. Secondary means it's being caused by some underlying disease, for example, a vascular problem. I'm sure you've heard that febrile people often sweat without need, or that menopausal women also have some thermoregulatory problems. Primary, however, does not mean we don't know what causes it. That will be idiopathic. In fact, we do. It's sympathetic hyperactivation. Your glands are absolutely normal. They are just being overstimulated. Things that would suggest secondary causes of hyperhidrosis are asymmetrical, including unilateral hyperhidrosis. It's not normal to be sweating only on your left palm, for example. That usually suggests some underlying neurological problem. Hyperhidrosis that begins in adulthood. Primary hyperhidrosis usually begins around puberty. It's not normal to start presenting with hyperhidrosis later in life. In fact, primary hyperhidrosis tends to improve throughout life as the patient ages. Hyperhidrosis in a patient taking certain medications. Hyperhidrosis in the presence of comorbidities such as obesity or thyroid problems. And, of course, hyperhidrosis associated with other new symptoms besides sweating. So how do you diagnose it? Well, there are ways to weight the amount of sweat in a certain area time, but the clinical history is usually enough. You can order some labs such as thyroid hormones to check for undiagnosed causes of secondary hyperhidrosis. And then we get to treatment. There are clinical, procedural, and a surgical way to treat it. The clinical treatment can be classified between topical and peroral. Topical are just creams, usually based on aluminum chloride. The pros are it's very easy to apply. The cons are it's not a very long-lasting solution. and it doesn't always work. The per-oral solution is quite an ingenious one. Didn't we say that the problem is sympathetic overactivation, that the glands are absolutely normal? Then why not use an anticholinergic such as oxybutynin? Well, it does work, and that's the pro. It works really well. The con, it's going to block sympathetic stimuli not only to the sweat glands, but also to everything else. So you generally get a lot of adverse effects. Then we also have the procedures. We have, for example, iontophoresis, which consists in running a direct current along the skin. The pros are it's painless and it tends to work decently well. The cons are it's not very common and can be quite time consuming. We also have Botox or botulinum toxin A application on the skin. The pros are it works really well and it lasts up to 6 months, meaning it's a semi-permanent solution. The cons are it's expensive and painful. You have to get like 50 needles in your skin. And then we also have some other procedures such as microwave thermolysis or liposuction of the sweat glands, which pros also work and are permanent solutions. Cons, good luck finding someone who does it. And we also have the surgical treatment for arthroscopic sympathectomy. Didn't we say that the problem here is sympathetic overactivation? So why not destroy the sympathetic ganglia? This way, we could cease this activation to some specific dermatomes. Now, don't get me wrong, we're not talking about cutting motor or sensory nerves. The patient will get absolutely all the movements and functions preserved. We're only going to cut the sympathetic ganglia. The pros are it's a permanent solution. It works really well on almost all cases and it lasts basically forever. The cons are it's a surgery, therefore it has all the risks that are usually involved with any surgery. Compensatory sweating is also very cited in relation to thoracoscopic sympathectomy. And it does happen, however it tends to improve over time following months after the surgery. So, if I have diagnosed a patient with hyperhidrosis, whom should I refer him to? Well, you could start by referring him to a dermatologist, or if the patient is already sold on the surgery and just wants a very permanent and immediate solution, you could also forward him directly to a thoracic surgeon. Primary hyperhidrosis is a disease practically without mortality, but it causes severe emotional distress and even some occupational disabilities to people that live with it. Thank you for watching this video, and since you are already here, why don't you consider also watching these here? And don't forget, this video is sponsored by myself. You can also buy my products on my store. And I'll leave you with some medical art while you decide which video to watch next.